First of all, just want to make sure that the rules came out in 2019, and it took a while for those rules to actually become effective. There were a number of lawsuits filed against the administration to try to negate the rules, including from the American Hospital Association and the Federation of American Hospitals. So it was a very rocky start, but mid 2020, the administration prevailed. The lawsuits were dismissed, and so at that point, Intermountain said, "Okay, we're going all in with price transparency, and we're going to be very transparent in what we do." We put together a task force of individuals and essentially put tens of thousands of hours into developing a rudimentary price transparency file that we put in place for the January 1st of 2021, which is when the files were required. There was, we also at the time, and Chris, and I appreciate Chris being on the call. We partnered with Turquoise Health to make sure that what we were doing was consistent with the expectations of the public. We were very, very, very involved in making sure that Intermountain Healthcare as a whole would push forward on transparency. We believe in transparency. We believe that that we should be transparent with our prices, and we also believe, while we respect the decisions of other healthcare entities, some not to participate, we believe that transparent prices are better for the communities in which we work. And so, in 2022, 2021, we decided that we didn't want to put in all of the significant, like I said, tens of thousands of hours of effort to redo our price transparency files each year. So we worked with an outside organization and developed a very robust price transparency file. Now, let me go back and talk about the specifics of price transparency. So there's hospitals are required to submit there's two parts to price transparency. There's what's called a machine readable file. That is a huge file for most facilities. It's every single service that the hospital provides, and all of and not only the gross price for what the hospital charges, but all of the payments that different payers that are contracted with the hospital pay for this service. Very, very complex. It involves inpatient services, outpatient services. It's just a very complex file, and frankly, it's huge. They can get into the hundreds and even thousands of megabytes on large hospitals. So it's difficult. That's a difficult file for an individual, a patient to look at. And so there's a second portion, which is called the shoppables requirement. That is 300 different types of services that the hospital could or should provide. 70 of those are required by the government. The other 230 can be designated by the hospital based on the prevalence of care that they provide. Those shoppable files are much smaller, much more easy to review by an individual. Individuals have the ability to look at these shoppable files and know pretty much exactly what their insurance company will pay, but there's no information about what the patient will be required to pay based on their deductibles, coinsurance, and all of the patient, the member required payments. So there's a second piece of that, which a hospital can put in place rather than the actual hard-coded shoppables file, and that is a price estimation tool. And so a patient can go in and put in the information on the service that they want to receive and can get an estimate not only of what the insurance company will pay, but what the patient will have to pay as well. That price estimation tool, we're actually putting that in place as of December 31st of this year, and that will replace the shoppables files, because we believe it's a better way for patients to interact with Intermountain Healthcare in receiving the information that they need to know what their prices are going to be before they receive care. So that's kind of the how Intermountain has come forward with price transparency. We believe, like I said, that prices should be transparent. As the No Surprises Act has come along, and I'll let I think I'll let Brian talk about the No Surprises Act. That law is actually intersects with price transparency in a couple of ways, and so you also have to provide price estimates for individuals that ask for them, and we're building that process as we speak, and believe we'll be fully compliant with that in the first quarter of 2023. So that's where we are, and happy to take questions about how Intermountain Health deals with price transparency. I'll also tell you that the requirement for insurance companies to post their prices was effective on July 1st of 2022. There are petabytes of data out there from the insurers. They just did a huge data dump of their prices. And so combing through that and getting the deep information out of that we're looking for is taking a lot more time than we thought it would. But in the end, we think that there's going to be great coordination between the delivery side of healthcare, the services side of healthcare, and the insurers in the pricing and the transparency of prices. So transparency right now is only health plans and hospitals, right? It doesn't require physician services to be transparent, you know, to send price transparency files. It certainly doesn't require other freestanding outpatient providers. And so you don't, the patient and the consumer really only has access to the files, the transparency files, and the cost files of the hospitals in the area. You know, there's a question here from Dr. Lane, which I really appreciate, which is how do physicians, how do these physicians and advanced practice providers know how to direct patients to the most cost-effective type of, you know, location of care, assuming quality is the same. You know, and it's important because, frankly, in Intermountain, we have a number of clinics. We also have a number of non-hospital outpatient services, which don't have their prices in the file, and so there's this problem that I believe is going to be solved over time, which is the patient is or the provider, the referring provider, is going to have to do a ton of research to find the most cost-effective location. We think there are solutions to this, which will do comparative costing, not only across hospitals, but across all providers over time. But the next step for regulators is to bring these other levels of providers and service providers into the transparency requirements. It's really nuanced, and I think that's the only way to say it, is it's incredibly nuanced because of the amount of detail that's involved. And so, you know, we have just to take a for example, the charge master at one of our largest hospitals is about 7,000 line items. That's individual charges for individual activities or supplies or services that are provided to patients. A patient that comes in, let's just use open heart, since that's the mode of the day. If a patient comes in for an open heart procedure, and that patient will receive while they're in the hospital is substantial. It depends on the surgeon. It depends on the length of stay. It depends on the if there are any complications or comorbidities in the process. It depends on a whole lot of things which are specific to each and every individual patient. If we look at the human genome, there are, with a few exceptions, no human being is exactly like another human being, and that's exactly the case. And so when you translate that to health and health services, then you think about all of those all the variability associated with a human being when they come in and receive care at a facility. And it gets incredibly complex. Now, that's one end of scale. The other end of the scale is the patients that actually receive just a diagnostic service, like a lab or an X-ray. That's easy. That should be very transparent. It should be very easy to compare across organizations, because an MRI is an MRI is an MRI. There's no variability in those services. So I think what we're going to have to do over time, and it's going to take a little bit of time, is we start with the easy stuff. And I know Chris is doing that. They've got a list on their websites when you look at comparability that shows exactly what where a facility is in terms of their pricing compared to other facilities for a certain amount of services that are easy to drill down on. And then we're just going to have to start looking at the complexity and start to bundle these prices so that there's little variability in them as we go. And then we put them in a band, and then anything outside of that band gets a different rate, right? And so if you're in the band as a patient, and we can do it so that 90%, 95% of the patients are in the band, that's the rate you're going to get. If you pop outside that band for whatever reason, you have a complication during surgery, you have other situations which would put you outside the band, then you get a different price that's calculated differently. That's where I think we're going to need to go over time. Certainly, Turquoise and the Levitt Group are doing a ton of work around that. The government is interested in this very much so. I think we're going to very much see much more transparency, so that it's more, it's not going to be like a grocery store, but I think it's going to be more like a car maintenance shop, where you take your car in, you need this, you need an oil change, you need you need your tires rotated. At the same time, there may be something else that you get talked about, if you can, before that, so that the patient always knows very transparently what the price of the procedure or the process is as they interact with healthcare.